abnormalities in children or our babies, how can they be prevented, and how do they present? Like, you find your baby and you know this one is an abnormality, I have to take this child to seek medical attention from the hospital. And with me is a specialist, Mr. Okoth Joseph, who is going to discuss with us and explain for us, our viewers, to know these birth defects or abnormalities which happen in babies. You're most welcome to the show, Mr. Okoth Joseph. You can introduce yourself for our viewers to know you.
Yes, thank you very much, Mr. Moderator, Mr. Sunday Tom. I'm very grateful for being part of this show today. I would like to really congratulate you all upon completing the year 2023. I know it might have come with issues here and there. It may have not been a good year, but the greatest thing is that God had enabled us to finish this year, and I would like to say Happy New Year, and I wish you all a prosperous 2024. Yes, back to the main issue here, as our dear moderator has already hinted on, we shall look at the different birth effects that present with most of these babies, and so we shall get into more details. So my name is Joseph Okoth, and I am a nursing student. I am in 4th year, and I also practice at a rural regional Faro that is still under supervision. Yes, because I've not yet graduated, but yeah, very soon we shall get there. So at the moment we shall share more about the congenital birth defects. Thank you, Mr. Moderator. Back to you.
Okay, thank you very much, Mr. Okoth, for that introduction. I hope other viewers have gotten to know who he is and what he does. So I come back to you, Mr. Okoth Joseph.
Yes.
We hear birth defects or these birth abnormalities. Actually, the common ones we know here in the society, these children having the split mouths. Maybe in a general term, in a simple definition, what are these birth defects or abnormalities for our viewers also to understand them?
Yes, okay, thank you very much. Now when you talk about birth defects, I know it may look something which is so abstract, or in a common understanding, birth defects are just the structural and functional abnormalities of any of the body parts that a baby may present with, that is at birth. Something congenital is something that is present at birth. We get to realize it when the baby has been given birth to. So it may affect several systems of the body, as we shall look at them into details as we go on with the show. And yes, by the end of the show, I believe we shall have shared more, and we shall get to understand exactly what these birth defects are. Yes, Mr. Moderator, back to you.
I've heard you talk of various systems that affect in the body. For us, we only knew it only affects maybe the mouth, the what. Are there also other various systems that affect in the body?
Okay, yes, and by the mere fact that it is a defect, yeah, it can occur in any part of the body. Does not necessarily affect only the face or the lips, or because simply that's what is most common, and it is what most people have real evidence. So that's why most people consider it when they talk of a defect. Most probably they will think of either it is affecting the mouth, the lips, the palates, but ideally that's not the case. Any part of the body can develop a defect, given the fact that if division or development during a pregnancy did not occur well at that particular point, so definitely we shall end up with the defect at any part of the body.
Okay.
Yes.
So also maybe to ask you,
yes,
there are some daily activities our women can do which can lead to the cause of these abnormalities. Maybe even actually before we go to that,
yes,
we have beliefs in societies,
yes,
that when we get these children who have these abnormalities, maybe
yes,
the child has a big head, maybe the child has a small head, the child has a split mouth. There are some beliefs that these children are bewitched. How true is that?
Yes, actually that is true, and indeed it is an interesting one. Even me personally, before I took the career path of medicine, at one point I used to think so, because you could really witness a child of a neighbor and has been born with, probably you realize something looks abnormal. Someone is born and all the intestines are exposed out. So at the end of the day, to the son of a man or a lady or a woman who may have never gone to school, will probably think, I have been so and so, I've been in bad terms with Mr. Tom, and we have had issues here and there. So at the end of the day, you might assume it is what? Probably it is what? The baby has been wished, yes. Yeah.
So meaning it's not witchcraft, it's just an abnormality.
Yes, true. These are just, they come in simply because during pregnancy, in stages of development, we have what we call, there are about 4 stages that occur in prenatal development. We have the germinal stage that occurs between 0 to 2 weeks, that's from conception to 2 weeks, and during this period normally we have just basically cell division taking place. Then the second stage of prenatal development is what we call the embryonic stage, and in this stage it is where we find most body organs developing in the body. So at this stage, if the pregnancy is not well taken care of, that's when we shall have all these defects coming in. Ideally at that point, all the body organs are being formed, the brain, the heart, the spinal cord, all body organs are being formed. So at that point, the mother of this baby or this child or this fetus should be well taken care of from several factors, as we shall look at them all. So at the end of the day, a mother who has not been well taken care of will develop such defects, and in most cases the society, because they are not aware of it, they will attribute it to what? To being witchcraft, which is really not the case.
Oh, so it's all about poor management of these pregnancies which lead to these abnormalities.
Exactly. These abnormalities, most of them develop during the period of organogenesis, which I said is in the what? Embryonic stage, simply because this is the stage where we have all organs are being formed. So, and that period ranges from 2 weeks after conception to 8 weeks most cases. Yes.
Okay. Thanks very much, Mr. Okoth Joseph, for that clear description. Hope also our dear viewers outside there, they are getting to know that it's not witchcraft, but it's just as a result of poor management in these pregnant women. Okay, again I come back to you. You have said it's as a result of poor management in these women. What are these risk factors, or what activities do these pregnant women do and put them at risks of getting or producing babies with these abnormalities?
Actually, let me first clear that it is not just the poor management alone, but though to some extent poor management also really contributes to the development of these defects. Now these defects are caused by several factors. We can attribute them to, they can be environmental factors, they can also be genetic factors, or sometimes both factors can combine. We can also have even certain gene defects that can be inherited from the subsequent generations, all lead to what? Collectively lead to the cause of these defects. And then to a greater extent, most of these defects, their causes are not yet clear, they are not yet known, and sometimes we refer to them as they are referred to as idiopathic, or in simple terms they are just unknown. We are not sure of the causes of these defects, but however to some extent there is a complex interplay of environmental factors, genetic factors, and also sometimes both factors can all cause to can lead to these defects. Okay. Yes, back to you, Mr. Moderator. Okay,
right. Thanks very much, Mr. Okoth Joseph. Also, there's these aspects that in case you are drinking alcohol, you are smoking, that it can put you at a risk of like your child getting these abnormalities. Is it true?
Exactly, that's true. Now let us get to the point. I previously talked of 3 factors. That one, it could be environmental. 2, it can be genetic, and the other aspect is it is unknown, it is idiopathic, or we can also have a component where there is a single gene defects or inheritances. Now back to your question, you talked of the environmental factors. Yes, there are very many factors that are surrounding us that probably predispose these pregnant mothers to these conditions, and we normally refer to them as teratogens. So now teratogens, these are substances within the environment or our surrounding that probably they cause the development of these defects in these babies during their during growth and development, or in the period which I talked of as the embryonic stage of the prenatal development. So to hint more on these factors, one of them which you highlighted on is alcohol. Ideally, alcohol is very, very dangerous to a pregnant mother, even at the least amount of it all. I know people have an aspect of saying that you can take a little, and yes, that little may not be harmful, but however, current study reveals that we are not sure of what amount causes these defects. So the only thing we can do at the moment is to completely avoid. So therefore, I would urge you all, the pregnant mothers out there, or even the husbands that are out there, or future husbands, to be like some of us are. Really, you should not encourage your women to take the alcohol, especially when they are in the first 2 months of their pregnancy. So alcohol has different ways in which it affects the growth of this child. So now I will collectively add on the other aspects like smoking. We also have these narcotic drugs that people use out there, marijuana, and you can mention them, but there are a variety of them. We also have other factors like, for example, exposure to certain toxins. We have certain heavy metals out there that probably can be found in the foods that we eat. For example, we have the vegetables, the sukuma wiki, and these heavy metals like lead, cadmium, mercury, they might be in soils where we grow these vegetables. So once you get to consume these foods, definitely you will end up taking these heavy metals. So really these factors can predispose the babies to developing these effects. Then also the other aspect is we can talk of the X-rays or the radiations. Could be the ultraviolet rays from the sun. Even also sometimes when like these mothers fall sick, you realize they can maybe someone can get a fracture and then they may need to do an X-ray. So exposure to these radiations alone may also predispose the these mothers to developing or these babies rather to developing these effects. Then the other component also may originate from just the mother herself, and we normally refer to them as these are factors of maternal origin. For example, there are certain diseases that if they are not properly well managed, they can equally affect the fetus or the growth of this fetus during that period. And there are some of them include, for example, diabetes mellitus. If not well managed, surely it can as well affect the unborn child or the fetus. Then we also have viral infections such as rubella, measles, mumps, several of them, chickenpox, a variety of them. If not well managed, ideally this will equally affect the fetus, simply because some of these infections have the ability to do they have the ability to cross the placenta and as well reach the fetus. So ideally, even the healthcare providers really need to do a lot in case pregnant mothers have such infections. Then away from that, we also even when these pregnant women get sick and they go to the hospital, their management must be a little handled by someone who is a specialist, or in most cases by an obstetrician, because these are people who take care of these mothers during pregnancy, or a highly skilled physician, because even dosaging of some of these drugs or the treatments that are given to these pregnant women, ideally it matters a lot. So you need to really take note. Once your pregnant woman has fallen sick, you need to take them to a facility whereby they will have expertise management. So you should avoid ideally going to clinics where you will simply be given some drugs and you will not be sure of, and at the end of the day they will predispose the fetus to such conditions. Some of those drugs could include the corticosteroids, they can include the NSAIDs, which are used to manage pain, which we refer to them as non-steroid anti-inflammatory drugs, for example, ibuprofen, we have the piroxicam, and several others. Most of these drugs also need to really be, their dosages have to be reviewed to ensure that the fetus is is taken care of. Otherwise, you will end up predisposing this baby innocent child to developing some of these defects. Then even also some vaccines really they are not recommended for pregnant mothers, because at the end of the day some of them have the ability to cross the placenta, and they will surely affect the fetus growing. So management of a pregnant mother will really need to review some of these things, and as you intend to care for a mother to the healthcare outside there, you need to make sure you carefully ascertain or take history from this mother and find out how old her pregnancy is. Otherwise you will end up risking the fetus, and at the end of the day we shall have all these effects. Then the other aspect is also we have stress, smoking. All these are components that affect these babies during growth in once their mothers are exposed to. So ideally to the husband out there, once if your woman is pregnant, yes, you need to avoid stressing her. You need to encourage her to have a balanced diet, because we shall realize some of these defects are going to be caused due to deficiency in some of the minerals. Probably that's why a given body part is not well formed, simply because the mother did not do take those nutrients inadequate. So back to you, Mr. Moderator.
All right, thanks very much, Mr. Okoth Joseph, for that detailed explanation on the various causes of these congenital defects. He has told us mainly the alcohol, they say like you take a little, but they don't know the exact little. So the appropriate measure for our dear viewers, especially pregnant women, he has recommended us to completely stay away from alcohol, not to take at all alcohol, especially even he did it clear in the first 2 months of pregnancy. Then also he talked of other causes like the viruses, these infections, and also you talked of these other drugs. In case you take drugs anyhow, also it can put you at a risk of getting of producing a child with these abnormalities, because remember you're taking drugs without a prescription. Before you take any drugs when you're pregnant, he recommended us to first rush to the clinic and get prescription from these doctors and nurses who will give us the right dosages we are supposed to take in case your woman is pregnant. Thanks very much, Mr. Okoth, for that detailed explanation on the various causes and risk factors of these abnormalities. Maybe again I come back to you. Do these abnormalities like have types, or they are just plain like that? Do they have types, or can be categorized?
Yes, through these defects, basing on the systems affected, we can categorize them and attribute to them to the different systems. So really, for us the healthcare workers to appropriately manage them, we put them in groups, or we group them according to the systems that they affect. Yes, Mr. Moderator.
Okay, thank you very much. So like what are the various systems these diseases, like these abnormalities affect?
Ideally these defects can affect any body system or any body part. In simple terms, that's what I should say. Okay. So ideally, but we shall look at just some of the common systems that are affected. However, take it that any system can be as well affected, provided or so long as the development or formation of tissues and organs was not complete or was incomplete. Definitely we shall end up with what? We shall end up with a particular body part not either underdeveloped or poorly developed or poorly formed, and we may refer to them as malformations. So we shall end up with these defects. Yes. Okay.
So can you like now try to categorize for us the various types and categories such that now our viewers can get to understand? Because actually me and also maybe I believe the people outside there will only know abnormalities in children having a split mouth, maybe having a big head or a small head. Maybe what are the other types of these abnormalities these babies always have?
Yes. Thank you very much, Mr. Moderator. So we shall look at them them, we shall categorize them basing on the systems they affect, and we shall just look at a few that are very common, and ideally there are very many over there, and if we really were to exhaust all of them we may not manage, but we just want to look at a few that are very common, and those that they endanger the life of our children or the babies once they are born. And starting with the first category, we shall look at first of all what we call the neurotube defects. These are a group of they affect specifically the brain, they affect the spine, and yes, the spinal cord or the brain. Then we shall also look at the other category is what we call the orofacial cleft defects. Those are defects that normally affect the lips and also the palate. Then we shall also look at some of the common defects that probably may affect the gastrointestinal system. Then we shall also look at briefly some of the defects that affect the heart, and then maybe we shall go and comprehensively system by system we just highlight on a few of them, because ideally there are very many, but as of today's show we are going to just focus on a few that are very common, and we shall be able to share more about that.
Okay, thanks very much. Hope our viewers have gotten to know about these various systems these congenital abnormalities affect. Yes. We saw the nerve tubal and also those which affect the mouth and the various systems of the abdominal system and the GIT system. So maybe now specifically let's first come on those which affect the tubal system.
Yes. Starting with the neurotube defects, and these defects are specifically involve the brain and the spinal cord. So the neurotube defects, and here we shall just talk about the three most common. However, we have several others, and one of them is what we call the encephaly. This encephaly, this is where we have it can be total or partial absence of the brain and the cranial vault or the skull, and also the skin covering the cranium. So in this case,
the child is born without a brain.
Exactly, may be totally absent or partially present.
Can that child survive?
Yes, in most cases, these children are studies that have been conducted show that their degree of survival is not much. Their prognosis is we cannot say it is not has not been clearly obtained, but to some extent, if given the specialized care, yes, they can survive. But of course, given that misery and that surrounds the family and the psychosocial aspect, sometimes even the family members may not be interested in taking care of this child. So you realize at the end of the day, because of such factors, this child is neglected, and at the end of the day the baby may end up passing on. But ideally, if given the specialized care they require, yes, they can live to a certain age.
Okay.
Yes.
Yeah, maybe now you can proceed.
Exactly. Okay. So I've talked about the encephaly, whereby the baby is born without the brain. The baby can be having partial or totally absent. The brain is totally absent, and then also involve absence of the cranial vault, or what we call the skull, and then also the skin covering that area is also absent. Then the next aspect of the neurotube defect I will talk about is what we call the encephalocele. Yes, encephalocele is a neurotube defect which occurs whereby there is a defect in one of the bones in the skull. It could be the frontal bone, can be the occipital bone, can be the parietal bone, can be the nasal bones. Yes. So once there is a defect in these bones we have talked about, you realize that there is a protrusion, or what we call a herniation or bulging of the brain tissues and the meninges. They will herniate from each of these defects, or what we call weaknesses in between these bones. So once that has occurred, in most cases these babies will present with a bulging depending on which bone has been affected. For example, if it is on the frontal bone, you will see a bulging on the baby's face, and then if it is let's say occipital bone, you will see a bulging at the back of the baby. Then if it is the nasal bone or between the ethmoid bones, you will realize there is a bulge around the nasal area. So depending on which bone has been affected or which bone was not completely developed. Remember, we started by defining these defects as structural and functional abnormalities. So in case any of those bones are not well formed, definitely we shall have that herniation occurring. Then the other third aspect of the neurotube defect that we are discussing today is we talked of the encephaly, we have talked of the encephalocele. So the third effect, which is also very common, is the spina bifida. I think this one most of the viewers out there might have heard of them, or you could have been you could be a couple out there and at one point you bore a child who had one of these defects. So today you should be able to understand why probably you had such a defect, or why you had your child developing such a disorder. So spina bifida is normally a neurotube defect that develops in whereby you have the bones or the spinal column does not completely close. So you realize that you might have a bulging of the spinal column or the tissues into in a kind of a sac, and sometimes you are produced, you give birth to a baby and has this kind of bulging at their back. Sometimes they may be open or they may be closed. So yes, you could have witnessed such a thing. So this spina bifida is another complex neurotube defect, but at least for it we understand normally it comes about due to once we have little or deficiency of folic acid in the mother's diet in most cases, because this folic acid is a very important nutrient in the development of these neurotubes. So once they are deficient, definitely we shall have the incomplete formation and we shall end up with such defects in the babies. Actually, that can be a point of emphasis to our viewers outside there, because whenever they're given these drugs during the pregnancy period, some of these women tend not to take these drugs, and some of those drugs given to them, I think there is also folic acid. So in case you take folic acid, you will produce a normal child, but in case you take you don't take the folic acid, now you produce a child who has this spina bifida. Yes, exactly. So the dose recommended for this folic acid is normally about 400 micrograms, but however, I know this is well taken care of by the healthcare providers. That's why it is very, very important for all pregnant women to have antenatal visits, because these are some of the services that are offered to them once they are there receiving this kind of care. So still back to the pregnant women or the husbands, I would really like to encourage you all to ensure that these pregnant mothers attend these visits, and ideally studies have revealed that more visits according to the current World Health Organization guidelines are yielding more the prognosis is getting better, because some of these defects are discovered early and they get to manage them, contrary to the focused antenatal care model that was previously used before. And this focused antenatal care model would only recommend about 4 visits during pregnancy, whereas currently the World Health Organization recommends at least 8 visits, and that means at least in the first trimester, which ranges from conception up to about 12 weeks, at least a mother should be able to have at least 1 visit, 1 antenatal visit. And actually it is between that period that the fetus is at danger, or it is endangered. So really you should encourage pregnant mothers to really attend these visits, because it is really very, very important for their fetus and also producing healthy babies. Okay. Yes. All right. Thank you very much, Mr. Okoth Joseph. I hope other viewers, you are getting to know all these things. Today we are talking about these birth or defects, abnormalities in babies, and he told us briefly the causes of these defects, like taking alcohol, smoking, and also the environmental aspect. Also, he said it can be genetical.
then also it splitted all these defects. So now we had started with encephalopathy and spina bifida. Thank you very much, dear viewers. Those who are still with us, let's get into a short commercial break. Then in the next segment is here what you should not miss, where I shall bring in all those other defects like the splitting of the mouth and how it can be managed in case you produce a child with intestines out and how it can be managed. Thank you very much. Let's get back after this commercial break.
Westnile TV, lighting up the region.
A brand new Global Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
We are the passion you've been waiting for! It's Yunus Junior Santamo! It's our league, our football, our boys, our style. StarTimes UPL new season starts 15th September. Go for it! What a finish for Master Fukume! The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on StarTimes.
The StarTimes UPL, our league, go for it.
Westnile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break. We can now pick on Mr. Okoth Joseph with other types of categories of these congenital abnormalities.
Yes, thank you, Mr. Moderator. The other congenital anomalies that are very common, we have normally the heart defects, though these ones we might not notice them, and unless these children or these babies have been reviewed by specialists or healthcare provider. However, some of them include one of them is the most common is what we call the ventricular septal defect. This is just a case in which we have a hole at the ventricular septum, the septum in between the ventricle develops a hole. So you realize that blood is shunted, or blood crosses from the left side of the heart to the right side of the heart, meaning that the already oxygenated blood from the right heart, which rather the left heart of part of the heart which is supposed to be pumped to the entire body, again instead crosses to the right part part of the heart which is not yet deoxygenated. So there is that component of blood with oxygen mixing with blood without what? Oxygen. Without oxygen, yes. Then the other aspect also, we have the atrial septal defect. Also in this case we have a hole in between the what? The septum of the atrium, or what we refer to as the auricles. Yes, and also the same thing occurs. We shall have blood flowing from the high pressure left crossing to the what? To the right. And then also the other aspect of the congenital heart defects, the other one we have is the what we refer to as the patent ductus arteriosus. And ideally this one I know may not be so familiar to our dear viewers because they are internal, but our dear healthcare providers can be able to realize or notice these effects, and probably they will recommend specialized care, or they will recommend specialists that will be able to help these kids. Away from the congenital heart defects, we shall also talk about one of the most common, which is a group of defects, which are the what we refer to as the orofacial cleft defects. These are a group of defects that also involve either splitting or separation of the lips and then the palates. The palate is that area, or that we refer to them as the roof of the mouth, the part on the upper part of the mouth, say. So we might have an opening at the roof of the mouth, or what we refer to as the palate. Then also sometimes it may involve the lip, clefting of the lip. In other words, there's a separation or splitting in between what? The upper lip of these children. And sometimes it may be bilateral, which means it occurs on both sides, or it can be unilateral, which means it occurs on only one side. And also sometimes it can, a given child or baby can be born with both the cleft lip and then the palate. Yes, and also there are instances whereby we have each of them is isolated. We have the baby being born with only the what? The cleft lip, or is only born with what? Cleft palate. Yes, meaning this baby has either the lip is separating from each other, or the what? The palates are also what? Having a separation or the openness. And now these orofacial clefts or defects, they normally occur because probably the tissues or cells at that area have not been completely performed in the process of development. So you end up having those splits what? At that point. So some of these cleft lip palates, most of them can be managed surgically, and that's why maybe some of you could have heard out there about the cleft lip surgical camps in various hospitals. Yeah. Or
actually, yes, they're always free.
Exactly, actually they are free. So always take this opportunity to go and experience the care that they give to these children, and yes, they can be able to correct such defects or abnormalities. Then away from the orofacial cleft defects, we also have the other common aspect in the mouth is what we refer to as the tongue tie, or what we can call the scientifically to us the healthcare providers, we refer to it as ankyloglossia. And this is a condition whereby we find that the tongue is held back by could be tissues of either mucous membrane, or yes, a kind of tissue that holds the tongue back. So such babies probably they may have speaking difficulties, they can develop probably feeding because the tongue is not able to move, so they will have such difficulties. And in most cases, babies who develop these orofacial defects, in most cases these defects are also associated to other congenital abnormalities or defects. For example, they can be having rather dental problems, they can be having hearing difficulties in future, they may also have mental retardation and several other aspects. Yes, so the next aspect we shall talk about, we shall also look at what we call the GIT system defects, or what we refer to as the gastrointestinal system defects. Those are defects that specifically affect the stomach, the esophagus, the throat, or the system anyway that through which food passes. That's what we refer to as the gastrointestinal what? System. That involves the stomach, could be the intestines, yes. So one of the common defects that occur here also, starting with the esophagus, we have normally what we refer to as the esophageal atresia. Meaning that simply refers to incomplete formation of the esophagus. Yes. Or we also have what we call the tracheoesophageal fistula. Yes. Now a fistula is normally an abnormal connection between two organs. It is actually a connection of the epithelial lining of what? Two organs. So in this case we are having the epithelial lining of the trachea and that of the esophagus. Yes, they are actually connected together, so have such kind of a defect also occurring.
In case the child is eating food comes from the esophagus into the trachea.
And actually in that case for such babies normally they have poor feeding, and they have normally whatever they take in there after a short while they will vomit it out, what we refer to as regurgitation. The food easily comes out. And then we also have these babies may be shocking all the time, they will be coughing. So once you notice such kind of things here, definitely you need to really notify the healthcare provider or the attending midwife or nurse once you've given birth to a child, because some of these defects are internally, they occur internally, so it may be difficult for you to identify. So once you've noticed such things, the baby is irritable, easily crying, yes, you may need to notify the healthcare providers. Then away from that, we also have defects that occur due to incomplete or poor formation of the abdominal wall, and here we shall basically just look at two conditions. One of them is what we refer to as the gastroschisis, and gastroschisis is also a congenital anomaly that occurs at birth, and it involves herniation of the intestines lateral to the umbilical cord. So normally once the baby is being born, you realize the baby with such a condition will have the intestines will appear out. I particularly one time witnessed one condition at a rural regional hospital where this baby was born, and all the intestines were actually out.
So like how do you always manage those babies?
Exactly. Now the management of these babies also require expertise, or what we call specialists or healthcare providers who are really specialized and they have enough knowledge and skills in managing this baby. However, some of the quick remedies are one of the things we normally do to manage these babies is we just look at, for example, these babies that are at risk of infections. They can easily contract infections because you just imagine the whole of your intestines are exposed out, and remember this is something which is connected to the internal system. So anything, germs, any infections, yes, can enter through. So we need to really look for a sterile clothing or drapes. Yes, normally this can be provided by the healthcare providers, or in case
do you always also put like a new skin on the intestines, or the skin develops and covers itself?
Actually this is now surgically managed in a way that they can try to we normally they involve they carefully do it in the theater, and they try to refix these intestines back carefully. Yes, so this is also done under specialized management. So in case such a condition has occurred, you really need to notify your attending care healthcare providers. So the other aspect is also these babies are at risk of losing heat. They can easily lose heat, so you need to provide covering to these babies so that they not lose heat. And then also the other aspect is of course once the intestines are out, these babies are going to have difficulties in feeding. They may not be able to feed very well, simply because the system which is responsible for managing or breaking down all the food components up to elimination is already is already is not formed well, and yes, these babies need to be either we can give them parenteral feeding. That is parenteral means basically you feed them through the veins. You just insert a cannula and yes, you can feed them through the veins. You give them things like for example, normally these are liquid foods that can be easily absorbed through the blood system.
Like which liquid food? Someone might just go and take porridge.
Exactly. That's why I said now management of these children is not done by any other person. This one now is specifically done by what?
Specialized.
Trained, yes, healthcare providers. It is not something which is just done at home. Yes, so this is something which is done by the what? The trained healthcare providers. So you as a mother or the father of such a child, ideally, all you need to do is just identify this condition, and then yes, this child will be managed appropriately and will be helped. Then also the other aspect, the other defect you have not talked about probably of the abdominal is still the what? This is referred to as the omphalocele. In this case, we also have the abdominal contents being expelled outwards.
The intestine.
Yes, the intestines actually. And in this case, these ones occur at exactly the what? At the umbilical area, at the umbilical itself. Whereas in gastroschisis, we saw that it was carrying lateral to the what? To the umbilicus, yes, or the umbilical region. And in this case, they are just exposed what? Outside. Whereas in omphalocele, they occur at the umbilical area and they involve a sac that covers, yes, this, yes. So, yeah, and they are still equally managed in the same way. You need to keep track of this baby. You cover the baby, the feeding, so that this baby can be able to have what? Yeah, nourishment. Because at the end of the day, the baby will get dehydrated, and the body is not receiving any nutrients. At the end of the day, the baby will starve simply because not receiving what? Nutrients in the body. Yes. So away from that, otherwise we have several others, but we have just chosen to speak about a few. Yes, the most common ones. Then when we go and review on system by system, we might also have conditions whereby the other most common aspect involves the skeletal system, what locally we refer to as the club foot. Yes, normally a baby is born with the leg is curved inwards. Yes, it flexes inwards, and what does what? The legs are curved inwards. Yes, it's also very, very common. And normally this one, it can be managed surgically. Once we identify it at an allergy, it can be corrected. So to you, the viewers out there, once you notice a child or your baby has been born and you notice the aspect of what? That clubbing or bending, or the legs actually folding inwards, yes, in a way that you realize the baby even does not, the sole is not there, and even the way the baby is stepping down, you realize it is not in a normal way. So you need to really report this to the healthcare providers that are currently attending to this baby, and probably normally we also have surgical camps that deal with this. Yes, we also have surgical camps that deal with this. That is in case the baby is what? Is being born and has such. So, and normally management of most of these conditions may involve several healthcare providers, might involve orthopedics, may involve surgeons, may involve physicians, will involve nurses. So ideally, and it is done in a way that each of the healthcare provider performs his or her role according to their training and specialty. So you might realize this baby can be managed in sequence. They tell you after maybe 2 weeks of this and that treatment, this surgery, you come back for review. So ideally things like that will be coming in. Okay. Yes. Then we also have maybe to talk about normally what we call the polydactyly. This is a condition whereby we have normally these children are born with more than 5 digits.
Yeah, the finger.
Exactly. I think you may have witnessed that somewhere. So in most cases you find this baby is having more than what? 5. You can have 1 here and yes, like that. So this one specifically may be inherited. However, also just like the factors we talked about previously, they may also predispose these babies to what? Such a condition. However, in most cases, these ones are what? Inherited. Then we can also have another defect which is still referring to the digits. We have what we call the clinodactyly, whereby you have the carving of the what? The digits, they curve to one side. Yes. So a baby is born when the digits are curving to one side. Yes, like that. So that is also very common. Then we also have a condition called syndactyly, whereby we have the baby might have 5 digits, but they may be fused. You might realize 2 of them,
like a duck.
Yeah, exactly, they are fused together. So such conditions may also exist. Then also other conditions or defects can have one of them is of affecting the skeletal system. We can have the scoliosis, which is the baby is produced with a curved spine, and normally this one you can notice. Maybe for example, you place the baby in a what? Sleeping position, facing downwards, and the way the baby is lying, you really note there is a curve. Yes. So then as I am summarizing, we can also briefly talk about also the baby. Maybe we also have conditions where the baby is born with a malformed chest, like it is bending. All these you can notice on just as the baby has been born. Therefore, there are a variety of several other defects we may talk about, but those that we have hinted on are the most common. And to the dear viewers out there, in case you notice such defects, ideally you should quickly notify the hospital or the healthcare providers nearby that can assist you, because most of these babies really require specialized treatment, and they may require treatment from experts that in most cases may not even be near our facilities. So you might realize they need to again keep contact with the other specialized healthcare takers. For example, in Mulago, the National Referral Hospital, in Mbale, where some of these conditions are managed. So once we identify these conditions and communicate, surely it can be good to ask the healthcare workers, and we can be able to help your child accordingly. Thank you so much.
Okay, all right. Thanks very much, Mr. Okoth Joseph, for that detailed information and discussion. I hope our dear viewers have gotten to know about these various types of congenital abnormalities, like producing a baby who has some abnormalities, like not being normal. So maybe if I take you back on the first abnormality, where we talked of this spina bifida.
Yes.
Which hospital is specialized for these babies who have spina bifida? Or people can get treatment from anywhere?
Okay, yes. Normally, for this condition, it is best managed at that Mbale Regional Referral Hospital. So, in case you happen to have this condition, from your point of healthcare contact or where you receive your care from, yes, they may refer you to that specialized hospital, or yes, for management of this this condition. So normally most most babies may be referred there for more better management, because it has all the team of expertise that may be needed to manage such conditions.
Okay.
Yes.
Yeah. Then again, to you I come. We have talked of this cleft lip palate, where maybe the child has a split mouth or lips. This child has come to the hospital.
Yes.
This child has been attended to, like they have done the surgical intervention, they have sutured these lips together. Maybe if it was the abdomen and the belly, they have now sutured the abdomen together.
Yes.
Which management, home management, do you always recommend these parents to do for these babies at home?
Okay, thank you. So now the home remedies or management will depend on which condition you are handling, and then also how has the condition, because some of them manage in different ways. So for cases whereby for example, the orthofacial defects like the cleft lip you've talked about, or cleft palate, Yes, these babies, you need to take care of their feeding is one of the things, because once they have these defects, normally their feeding may be impaired. So you need to seek for care, for rather advice on how these babies can be cared in terms of from specialists. For example, the breastfeeding positions, you have positions that are recommended for these babies. You remember we talked about some cases where you have oesophageal atresia, where there is a complete deformation of the esophagus, so where this baby may involve regurgitation of all the contents they take in, or may involve vomiting, anything they take. So there are specific breastfeeding conditions that are recommended for these babies. So to the mothers out there, yes, you need to take care of this. Once your child has such a condition, yes, there are specific conditions, rather positions that will be recommended for mothers to place their these children in. Then the other aspect also still about the feeding, some of them, if the defect is along the mouth and involving the esophagus, yes, they might create some surgically make some incisions or some cuttings around the stomach, and they insert tubes through which these babies will be fed. So care of this tube basically ranges. You must just remember you can introduce infections through this place, so you need to always keep cleaning that area. And normally we apply once the area has been cleaned, we normally remember also some of these contents are corrosive, especially the stomach contents that might be coming from that area. So you need to be putting like some kind of cavera around that area to prevent whatever contents that will come out from that area from corroding the stomach walls, yes, or even the whatever as a whole. So ideally these children need to be managed wholesomely, and yes, once taken care of, these children can they can recover from this thing, and then they grow well. That is only if we notice it at an early period, and once interventions are taken early enough. So ideally, yes, these kids can be helped, but most importantly, you need to take care of hygiene and also feeding. Yeah. Those are the most important things, because once the baby is not well managed, they will develop infections that will further make them develop more other diseases that will further worsen their health status. And also feeding, yes, you also need to feed these babies, because ideally they need nutrients for growth and even recover from the conditions they are having.
Okay.
Yes.
All right. Thanks very much, Mr. Okoth Joseph, for that discussion. He has emphasized the breastfeeding and also emphasized hygiene. Maybe in just like 1 minute, just give some prevention measures before we conclude.
Yes, thank you. Conclusively, I already talked of the factors that are environmental that most probably cause these defects. One of them will have alcohol. We should really stay away from alcohol, especially the pregnant women. Talked of smoking. We also had the aspect of narcotic drugs, the marijuanas, and so forth. Then also the maternal conditions. In case you're a mother out there, you realize you are sick, you have, let's say for example, you're suffering from syphilis, you have diabetes, you have viral infections such as rubella, measles, mumps, you should really notify your healthcare provider so that these infections can probably be managed. And you should also notify your healthcare provider of the state of your pregnancy, like you need to notify them of how old the pregnancy is, the number of months you've spent. It's also very important in order for us to design which kind of treatment to recommend to these mothers.
Yes, all right. Thanks very much, Mr. Okoth Joseph, for that detailed information. Hope our dear viewers who have been with us from the beginning to the end, you have benefited a lot on how to prevent these abnormalities in case you are still pregnant. We are glad. We wish you the best of your day and a happy, prosperous new year. Maybe some conclusion remarks as we finish for the
yes, thank you very much. At the real viewers out there, you really need to take note of all these aspects we have talked about. Otherwise, with that, I would like to wish you the very best of the new year, that is 2024, for God and my country.
All right. Thank you very much, dear viewers. Blessed day.
Thank you.